I do think a lot about how do I think, and how do doctors think, but how do I think in particular, and how do I think in ways that lead to mistakes in judgment, big, small, in between, and how do I think in a way that leads to the best possible thought processes and the best possible, kind of outcomes for the patients. And it makes me conscious of, well, how do other people think? How do non-doctors think? Because again, my biggest lesson was maybe I have more to learn from people who aren't doctors, in thinking about this than people who are doctors. Or maybe I've learned everything I can learn from doctors. Maybe I need to learn from people who aren't doctors. So, if I'm reading like a crime novel or a mystery novel, I'll think, how do those guys think? The characters in these novels, they're not these like perfect, put them on a statue people. They're always flawed, but they think really hard. What am I missing here? What am I missing here? And they work in teams and they bounce off each other. And I think about that when I'm reading these novels. James Lee Burke, I don't know, any of these novels that you read for fun, except that there's something you can learn from how do detectives work so that they don't miss something, so that they don't just kind of go down a narrow path and keep following their own flawed misconceptions, and actually keep entertaining all possibilities and make sure that they aren't missing something. They do that all the time to solve mysteries. What can I learn from them? So even in sort of entertainment, I try to think, what can I learn from the way that person thinks?